Hi guys, thanks for joining our YouTube channel. Today I have Mrs. Hurt with me. By the way, she's a great golfer. She actually has won, your club championship 5 times?
6 now.
6 now, so see. Anyway, today we're gonna actually help you guys, help a lot of the people out there who are avid golfers or not, or even the novice golfers to understand about hip mobility and how important that is to how well you turn in golf, and also to prevent against injuries. Mr. Hurt saw me, I want to say about 4 weeks ago.
Yeah, about 6.
About 6 weeks ago, she came into us after some complication for the past couple of years with the low back. She's been through all the gamut of surgery and other form of therapy for her low back. So now we finally have gotten her after treatment for about 4 to 6 weeks or so. We've gotten up to about 90%.
Oh yeah.
So she's back to her old form. She's not golfing without pain, but it's just a little twinge for the most part, right? So I'll have her walk you through of how she's feeling prior to when we worked on her, and how she's feeling now.
Well, when I first came, I couldn't make a golf turn. I've been in pain for about 2 years, specifically the right hip area and low back. And after at least maybe the first 5 visits, I was able to start to have much better turn. I was able to play in the club championship because of Dr. Chip, and I actually won. So now after about 6 weeks, I'm about 90%. I don't have much pain at all turning until the last 2 or 3 holes, so I'm super excited.
So, and again, most of the soreness that you're coming through and some of the pain at the end is from the fatigue. So we still have to put her through some rehab program, and she's doing some on her own now at home. I always like you guys, after treatment, when you guys are feeling better, I always recommend everybody to get into the gym. If you can't do it by yourself, get a trainer or go and have PT done. Either way, I look at it as that for us, chiropractic wise, we treat you guys to get to over the injuries. I like to refer people out to PT. After that is like after you wash your car, the PT is like waxing your car. Is what's going to keep you there, or weight training and so on with your trainer, or you can do it on your own. So whatever it is, get in the gym after that. So otherwise, your condition can regress without the strength there to help you. So today, what I'm going to go through is some basic, stretches, and also just kind of what to look for if you're going to try to examine some of your functionality or range of motion on your own. So I know a lot of you guys out there, and a lot of guys particularly, you guys don't want to go to a doctor, right? So you want to treat everything, yourself. So we're going to help you to kind of see where you are, and then hopefully then that will help you to understand how far behind you are, and then so you can go out there and take the appropriate step to go for therapy or go and see a chiropractor or whoever it is out there to help you get your function back. First thing I'm going to walk you guys through is just to check out the hips. Most people don't realize what normal hip functions are, right? So again, the basic hip movements we want everybody to have. Of course, with the caveat is that if patients, some of my patients are older, that have hip replacement, so of course you have that, and of course we definitely recommend you guys to go and seek help with a physician or a therapist to get worked on, so you can't do this stuff by yourself when you have a replacement there. But if you don't have any spare parts in your knees or in your hips, this is what I want all my patients to have the ability to do. So the first thing is to be able to have the knee touch the table when you go into what I call the figure 4 here, okay? And that should be normal on both sides. And the other one, of course, we want everything to be dropping down from before you, like that, okay? Now again, some patient will get stuck up here. Literally, the knee will not come down any further, okay? Now some of you guys might be here, and then some of you guys might be further. Now, some instances when the knee is stuck higher, patient might have moderate or severe arthritis, and further down might be moderate and so on to minimal to mild arthritis if they're only able to get their knee down to about this far. But that's not always the case, because sometimes you might just have an impingement in the hip or a contracture of the hip joint that restrict the range of motion. So just because you have pain And just because you have lack of range of motion doesn't mean that you have arthritis in your hip. The only really true way to find that out is you either have an MRI or an X-ray done on your hips, okay? So you need to have, again, just to reiterate that, you have to have your knee, when you do this, resting comfortably on the opposite, with the ankle on the opposite knee, and this knee should be able to drop down. And right now, Ms. Hurt doesn't have any pain at all, right, Ms. Hurt? It should be just a nice little stretch, and that's it. The other one we'll show you guys, you know, when you're on your back here, is the ability to keep your shoulders down, okay? So this actually imitates the golf swing, you know, by the way. So in a particular golf swing, you rotate the shoulders and you keep your hips, you know, still. Here we're actually going to keep the shoulders still. We're going to rotate the hips over, okay? Now this one actually checks for the musculature in your hip, in the hip area. So what I want people to do, now when we talk about hip muscles, I'm talking about the piriformis muscle, the gemellus. We're talking about your glutes muscle, in particular the gluteus minimus and medius, and some of the TFL, and also in some part the IT band too. All right. So with this here, as you bring the knee here, what I want all my patients to do is have the ability to come up slightly here with the hip here, with the shoulder back, and your legs should be level or parallel to the ground with the knee down here. If you're stuck here and you feel like, oh boy, I have a lot of pull or pain or discomfort here when you're trying to bring this over, that should tell you that you have a lot of contracture or spasm in the hip area. And when Mrs. Hurt came into us, hers was pretty high up there, right?
Oh yeah.
So it was on her right one, and she was restricted pretty high up there. So,
right.
So with a lot of work, we're able to get that down here. Now she's rotating that really well without any, you know, she has some minimal discomfort, but the range is great, and you can see, and that's why that's going to enable her to follow through really well. Now another one that you can do, which you need some assistance with a doctor or a therapist, is that you can actually start to stretch the low back out, the QL muscle here, by rolling this further to keep the QL or the low back more rotated here. And typically, you know, that's a little more advanced. So, but for right now, again, just to go through the range of motion again, when you bring your knee up, you should be able to bring this all the way over, nice and easy, with the hip coming off with the SI joint and the low back coming off the table here, and you should be able to rotate really well. Okay. So then bring it up, and we'll show you guys one last stretch. And let's have you go face down for me, Mr. So the last one it's the last, but it's definitely not the least. It's the most important one to me in a way when it comes to hip functionality and just helping patients to alleviate low back pain and hip issues. People call this the iliopsoas muscle. I call it, for the sake of easier for the patient, I call them the hip flexor muscle. So the hip flexor muscle is the one that's designed to bring your knee up this way, okay? So to stretch the hip flexor out, it's designed to bring your leg or hip back into extension. So with Ms. Hurt lying down like this, first thing I check for is trying to help you guys see how tight you are. Because typically what happens is, what I see in my patients, that if the hip flexor is too tight, okay, and by the way, the hip flexor actually goes in from the front and diagonally and comes in and attached to the L1, L2, and L3, and L4 of your low back. So when it's tight, it literally will pull your low back downward, which will oftentimes create a lot of back pain in the patient's hair. Now, typically, what I see right off the bat is that when patients have tight hip flexors, the first thing that's going to be tight on them, oftentimes, are their quads. So again, all you have to do is just, again, you can do this, you know, by yourself. You can bring your hand back and see if you can approximate the heel to your glutes. Now, most surprisingly, you'll be surprised that some people, they're stuck here. Okay. Now, even despite any knee issue at all. So again, if you have some knee issue, it's going to be a little tougher. But again, if you don't have any knee issue and your quads are really this tight and it's stuck here, then that tells you have to stretch your quads out. And if your quads are tight, guarantee your hip flexors will also be tight. So how do we stretch your hip flexors? We're going to bring this upward this direction. Now, we always want to have the patient keep the hips level and bring it up. Now, there's two ways you can test. You can test for the iliacus muscle here more, and as you bring it out here more, you actually would test for the psoas muscle. Add it all, Mrs. Hurt?
Just do the stretches. Do what he tells you to do because it works.
All right, awesome. All right, thanks for joining us, guys.